Welcome guys to today's episode. Now, today what we're going to be talking about is hip shifting in the squat, as well as like lower back pain, and why that might be. The lower back pain can be like a referral from hip shifting or rotation during the squat. Now I'll tell you where this comes from. A lot of times I'll do videos based on questions that my lifters ask me or reviews that I get left, etc. Today's one is from one of my lifters. I'm just gonna say his name, Big Al, because I know he won't mind, because I've already told him that he's being a cunt, he's not listening to me, and he's got to stop listening to his fucking physio, and I'll tell you why. And I told him I was gonna say that, and he's okay with it. Big Al finished the deadlift competition in December 2020, and then like pulled 200 kilos, but then a couple of months later, done his back in, lifting up an esky. He had a couple of drinks. That's from what I hear anyway. That's what his sister tells me. Big Al has kind of not confirmed that with me, but he's probably too sheepish to tell me. But ever since then, he's been getting a little bit of lower back pain, and then we've started to notice some hip shifting in his squat. Now, Big Al has been pretty tight in the hips since I've known him. He's pretty like stiff as a board sort of type of bloke. And he's went to this physio to get massages. They haven't really worked, so they've tried to, that person, I don't know whether it's a male or female, just called the physio, has tried to give him an answer. So first of all, it was the hamstrings, and I was like, he was getting back pain, shooting up his back, and they were like, oh, it's your hamstrings. And I was like, well, hold on a minute, if you think about it, at the bottom of the squat where he feels most of the pain, like right at depth or just below depth, or parallel should I say, your hamstrings are shortened. So why would it be those? Okay, right, yeah, kind of looked at me like, you know, I was talking Chinese. And then he then comes back to me a few weeks later, or maybe a week later, and he was like, oh, it's my glutes, like I got tight glutes. My physio said that my glutes aren't active. Anyway, I fucking blew up. I just kind of just went, just spoke at him for like 10 minutes. You know one of those things where you go at them, you walk off for a second, and then you come back because you're not quite done. I've done that to him. And then the most recent one, I was like, 3 strikes and you're out, fuck, I'm doing a video on you. He did one on, apparently it's now anterior pelvic tilt. Now I can understand, as you know, why people would pick anterior pelvic tilt, tight lower back, tight hip flexors, weak glutes, weak core, inactive, blah, 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 blah. But does it cause hip shifting, like lateral hip shifting? I would say most cases, almost 100% no. In most cases, it is a lack of mobility and stability at the hip joint itself, right? Think about these 3 things, and I'm gonna just kind of cover each of them as we go through this video. We're getting some videos up on screen with some drills to help, because I've done this with myself, I've done this with plenty of lifters in the past. I remember I had to deal with lateral hip shifting to my left side, and I was getting a lot of hip pain back in 2018, I believe it was. So I've been through this, I know exactly what's causing it, but it's the small things that equal the big changes in this one. It's not just one big change. So I want you to think of these 3 things: mobility, stability, and then strength. Right? Before you can get strong in an exercise, you need to be able to become stable at end ranges, and then before you can become stable at those end ranges, you need to make sure you have the mobility the mobility at those joints to make sure they can get to those ranges, right? So a good way to begin understanding about you know, where you're tight, get an understanding of what part of your hips are quite tight. You can start with bodyweight squat. There's also a test called the Faber test. I'll put it up on screen now as I'm performing it. This is at the start of my warm-up drill for this specific issue of hip shifting. As you can see, my left side's a little bit higher than my right. Now, why do we test for? I really like the idea of testing something, i.e. on screen now with the Faber test, and then performing some mobility drills and then retesting, see if you feel any looser, right? By using the Faber test, by using, you know, a bodyweight squat, and then by maybe even using a barbell squat. You can test with any of those. I'm also going to stick up on screen now an internal rotation drill for you to have a look at as well, because as you can see, I'm lacking on my Faber test, when I'm lying down looking at external rotation, that's what it's for, my left leg is higher than my right leg. In this test here, you can see that my right leg internally rotates better than my left leg. So I have some tightness inside of my left hip, which I already spoke to you about. I used to shift laterally to my left when I was squatting. So there's still some tightness there. Not a huge amount, but there still is some tightness, and I need to make sure I keep on top of it. Especially, I'm like 2 weeks out from competition right now, and I'm fucking stiff as a board. I'm really, really tight everywhere, very, very fatigued, and I need to make sure I stay on top of my mobility. So the first thing that you'll look to do is test something, right? And here we're going to test external rotation. You can also test like a body weight squat or a barbell squat, but I do recommend you looking at external rotation. In most cases, it is external rotation that people lack able to stabilize inside of that position. So a couple of mobility drills that I advise you to do every time you're in a gym, no matter whether it's squat, bench or deadlift. If you train 4 times a week, you're doing these mobility drills 4 times a week, 2 or 3 sets of around like 30 seconds to 1 minute, depending on how good the stretch feels and how quickly those muscles around the hip relax. But if we start with the first one, it's the banded mobilization drill. I've started using this years and years ago, and I use it with plenty of my lifters now. It's probably my go-to for every mobility drill around the hips. And basically what you're doing is you're wrapping a band around the top of your hip. You're going to step out to make sure the band has tightness inside of it. Kneel down onto one knee, and then using this is on my left leg, grabbing on the inside of my ankle, using my knee to push and gently to force a small bit of external rotation through my hip. And what you're not quite seeing happening is the band is pulling my hip backwards. So it's just kind of like creating room inside of the joint, pulling the femur out of the socket to give it some room. So it has like created extra range for that joint to move in, right? So I'll perform that, a couple of sets of like 10 to 30 seconds. It's quite short here, but that's my starter one, right? And I'll do that on normally both sides, but just in this video I've given you one side. The next one is the elbow towards heel. This one is pretty challenging. I get a good stretch all the way around my hip joint, from the inside of my thigh, my hamstring, my glute, even a little bit coming into the front of my hip. And basically what you're doing is you're setting up the same as a banded mobilization drill, but you're trying to reach your elbow to the floor, as you can see. And it's a very similar drill. You're creating a small amount of external rotation, just gently forcing it. You can see it's like my tricep and shoulders, like slowly pushing into it. And we, again, just stretching out the muscles around the hip joint, giving that hip more room to move it, creating extra range. We're forcing it a little bit slightly, but if you're tight, this is going to be a great exercise to really stretch out your hips. You'll be stretching your glutes. You might even find you're stretching the lower back a little bit as well. And then the final one is a banded hip flexor stretch. This one is, well, look at me, I'm like, got my little, what I call pussy pad for my knees, because my knees are getting a little bit sore kneeling down all the fucking time. I'm not one of them hoes who can just get on their knees every time. But yeah, it's a very, very simple drill as well. I'm just stretching out the front of my hip flexor, For people, this is where when people get a little bit of tightness in their lower back, they feel quite tight. Sometimes it can be from their hip flexors and just overall needing a stretch to open up that front of those hips. But what you will see that I'm not doing is arching my lower back. If I had a tighter t-shirt on, you'd be able to see that my back is straight throughout. What I'm doing is I'm squeezing my left glute and I'm allowing the band to pull my hips forward, but I'm also moving my whole torso forward as well. So I'm still keeping the stretch in the front of the hip. I'm squeezing my left glute, which is stretching the front of my hip, and I move as the band's pulling my hip forward, as the muscles around the hip joint start to relax, I'm gently moving with it as well. So I recommend doing 2 to 3 sets of each of those exercises for 30 seconds to a minute, depending on how nice that stretch feels. And when I say nice, if it's like, holy shit, this area is tight, fucking stay in there until it's relaxed. Don't be a pussy. I know plenty of people who just try to get out of it super quickly and they rush it because they don't like how the stretch feels because they're super fucking tight. Well, newsflash, my friend, you're gonna have to deal with that for a little while until it starts to ease off, because you'll become less tight. So 2 to 3 sets every single time you train, and you will begin to feel more movement, more range, less tightness. less pain inside of your hips, like less little niggles around like the lower back, front of the hip, even in the back of the hip there. So that covers mobility, right? Step one, which we spoke about. The next one is stability drills, okay? So stability is basically your body's ability to resist load. So as any individual squats down and you start to see them shift laterally to their right side, this is what happened with Big Al. He is just unable to create external rotation in those hips and then hold that position as he's squatting down. He will tend to favor his left leg and shifting over into his right side. It's kind of like, think of it as like an 80-20, like he doesn't know how to create a 50-50 balance inside of his hips, creating that external rotation and holding it. All right, so before you can strengthen a position, you want to make sure that you can get into a good position, whatever good means to you. But what I will say is what it doesn't mean is seeing your hips like shift all the way out over this way. It would mean straight up, straight down with limited twisting, shifting, anything like that, right? That's what we'll classify as good, just moving straight up and straight down. And the first one that I'll give people is some single leg press. It'll be up on screen now. As you can see on screen, I'm focusing on that external rotation of the whole leg, creating as much torque as I can in that right hip. And then I'm going to be lowering the leg press gently, making sure that I'm holding that tension. A lot of this stability, these stability drills are going to be used at a tempo, because the slower that you go, the more time you have to feel what muscle groups are working, where is your body moving in space, and then you can start to, what's the word I'm looking for? Create that coordination that you're looking for, because sometimes it can be a lack of coordination inside of there as well. So that kind of goes hand in hand with stability. So the single leg press is the best thing that you can do. You want to be able to take someone from bilateral to unilateral, and the single leg press does that. You can do that on both sides. I recommend like 2 sets of 10 on each side, making sure that you're holding tension at that right hip. The video itself is on my YouTube page. I've muted it so you can't hear it, but you will be able to find that if you put in single leg press, as are all of these drills. The next one, banded wall sit. This one is just like, it should be like a master stability drill, because especially when it comes to squatting, because not only does it replicate the movement pattern that you'll be going through, but it is far more challenging if you're doing it correctly than what you think it is. You're just kind of like, oh, I'm just leaning up against the wall and I'm squatting down with a band around my knees. No, well, yes, but no, it's far more like challenging than that. It's a very simple drill, but it's far more challenging. I've seen guys that can squat like 300 kilos and you put them into this banded wall sit, focusing on holding tension at the bottom of that like end range which they're in, and they do like 3 reps of this, 3 reps out of 5 or 6, and they're holding at the bottom for 1 to 2 seconds, and they're like puffing away. It's very, very challenging, especially if you're someone who struggles to hold tension and torque at their hip joint itself. So what I recommend you do here, a couple of things. You take like a 2 or 3 second tempo down, keeping your lower back pressed against the wall. And what you're making sure that you're doing is rotating your quads out, feeling that tension around the back of the hip, inside of the glute, away from the front of the hip. And you want to squat just below parallel or within that range that you can get without your hips starting to shift left or right. Okay, so you're looking to avoid shifting. You're looking to hold tension at that at your hips. The reason why I give the tempo is because as you go down gradually, you'll notice that your body might start to want to shift out of position, and you can correct it, i.e. coordinate it back to where you want it to go. The next kind of step up that you can do, or another variation, is a bodyweight squat, where you'll start to squat down, and as soon as you feel any kind of shifting or any movement that you don't want, you pause just above that position, hold there, make sure you've got the tension, move slow again until it happens, and then you repeat that process until you can squat to depth. 3 sets of like 6 reps or 2 sets of 6 reps will do you fine here. And then the final one is what they call the aeroplane hold. That's what I was taught it as. And what we're doing here, this is like a mixture between a mobility and a stability drill for me. On one side, of the mobility side of things, you're really, as you can see, I'm creating, like externally rotating through my left hip, and I'm trying to open up my hips as much as possible, thinking, okay, pelvis facing the wall, belly button facing the wall, keeping my right leg as high as possible and holding all that tension inside of my right hip whilst getting a nice stretch. And then you'll see I'm going to be doing one with the barbell for people who need it assisted. You don't want to be rushing to the next one, which is just standing there by yourself and performing it, because that is pretty damn difficult. I don't advise that right at the start. I advise you to do some ones where you're holding on assisted aeroplanes. So those are my 3 drills that I would advise you to do for stability. So far we've covered mobility, stability, right? The two main pillars, so that you could, one, you've created more range for your hips to go through. Second thing is you're learning how to stabilize your hips inside of that new range. Makes perfect sense, right? The final thing is obviously the strength side of things. You want to strengthen that good position that we've just spoke about. So when you're looking at in the squat itself, tempo squats and pause squats are going to be your best friend. Before you can squat 100 kilos without any lateral hip shifting or without any kind of rotation or butt winking, you have to do it at 50 kilos, 60 kilos, 70 kilos, and so on and so forth. And you just gradually work yourself up. I advise you to make sure every time you squat, you get a recording from front on, and you're just looking and going, how well am I holding that external rotation? For Big Al, it was on his right hip, and I'm just going, just learn to hold it, learn to hold it. And instead of jumping up from 50 to 60, 50, 52 and a half, 55, 57 and a half, and that might be over weeks, it might just be over sets. You don't want to jump up too quickly. The tempo squats itself are so that you can, coordinate and make sure you're holding that tension without any movement. Pause squatting is so that you can, if you get right at the bottom and you find right at the bottom of the movement, you start to shift or rotate, you're learning to hold your position at that end range that you want to work within. And then accessories, things like goblet squatting, leg press, both feet, unilateral, Bulgarian split squats are great. You can do like lunges, Bulgarian split squats, front foot elevated Bulgarian split squats, or whatever they call them. Great exercises. Make sure you are doing a lot of unilateral work, working on that coordination of whatever side you are shifting into, so you can stabilize that side and continue to strengthen it. But with all that information thrown at you, I advise you to go back, listen to it. Let me just say this to wrap it up. It is the small things that is going to get you out of having this shit squat. Right? It's the small things that you do every single day or every time you train, and you need to have patience. Right? So what I advise you do is go over to my Instagram, because by the time this video is out, there is going to be a post up there with these mobility drills in, with the stability drills in, so that you can just screenshot it and use it for when you go into training. Get some videos from front on. If you would like my help, you can email me. You can't email me. You could, but I am giving you my email, so that'd be weird. You can hit me up on Instagram on both Black Dan Barbell, as well as Facebook at Black Dan Barbell, my personal one at JF_Delaney, and just ask me for any advice on the squat itself. But again, just do it right. Take your time with this. It's not just going to take a week. It might take 2 training blocks. That's 10 weeks. 10 weeks of pulling your squat back to make sure that you create the good squat that you're looking for, the perfect squat that you're looking for, is far better than continuing to try to squat with lateral hip shifting and back pain for the next year and not really get anywhere. Do you know what I mean? It's a pretty dumb idea. So take this advice. Always think mobility, stability, and strength. What one do you need to work within first? And if you have any questions, or you would like to do a video, or would like for me to do a video for you, comment below or hit me up on one of my socials. As always, guys, please subscribe, please like. Really appreciate it when you do. I've seen my followers go up, I've seen my likes going up, so it is really, really nice. And I will speak to you next week on this channel.